Welcome to the Nursing Experts Translating the Evidence workshop. Our goal today is to help you learn how to find high-quality information and how to apply it to program development, policy writing, and grant writing. This project has been funded with federal funds from National Library of Medicine, National Institute of Health, and Department of Health and Human Services. Our goals for this section are to review the PICO format and examine the process of Internet searching for public health questions. Searching can be a cyclical process. We start with a question, but based on our results, we may have to circle back and reframe our question in order to move forward. Let's do a quick refresher on asking the clinical question with the PICO format. Before we do our search, we need to figure out who our population is, what intervention we're comparing, what we're comparing it to, and an outcome of interest. In some cases, your comparison could be no treatment at all or the current standard of care. Here's our example. Does STI education via social media decrease risky behaviors and incidence of STIs among high school students when compared to the current education? All research is not equal. The pyramid of evidence is a useful way to visualize research by strength of evidence. The bottom of the pyramid, we have expert opinion, which can include editorials or literature reviews. However well written, they lack strong evidence. Next up on the pyramid, we have non-experimental research. Qualitative research, retrospective studies go here. They require a lot of data, but lack hard evidence. One step up, we have experimental research. This is often more clinical with randomized control trials. Though vigorous, it's still one view. At the top of the pyramid, we have reviews of evidence. These go through existing research systematically to compare and contrast. It's the highest level of evidence because it has the most proof. When we think about searching for evidence, we need to consider there are two types of literature, primary and secondary. Primary literature requires our appraisal. For example, these are articles reporting the results of research projects. They may be fabulous research projects or they may not. You will need to read them and evaluate their worth for yourself. There are lots of sources of primary literature. Two of the most common sources for nurses are PubMed and CINAHL. Secondary literature has already been evaluated and synthesized, typically by an entire team of experts. The team of experts follows a set of procedures to find the relevant research and combine the results into one report. This type of literature includes systematic reviews, meta-analyses, and practice guidelines. This type of literature can be found in PubMed and CINAHL, but can also be found by searching the websites of organizations and government bodies that produce these secondary literature types. You may have heard the term Boolean Operator before. These terms are used to assist in the search. And combined searches. It's the overlapped part of a Venn diagram. Or gives you more. You'll get results featuring either term. This is both circles completely filled in. Not eliminates a term. You don't want a certain aspect of something covered, only one circle is filled except the part that overlaps. There are a few other tricks to searching depending on where you're looking. Using limits and filters, you can often narrow down your search by publication date, whether it's peer-reviewed, or by a certain age group. It can also help to put phrases in quotes. This tells the database to search for that exact phrase, not just the words in it. In the next section, we'll talk about how to choose the resources.